Hello, everyone. Welcome back. Today, I'd like to talk about healthcare in America and the price you have to pay for it. I found two relevant pieces of internet information, lore, you could probably call it, about how wildly expensive our healthcare is. The first one that I found was somebody shared with me a post, a tweet sent out by Bernie Sanders, and I'll just put the screenshot up right here, and it goes as such. Have you ever avoided taking an ambulance because you could not afford it? The ambulance is not your taxi to the hospital. What in the goddamn fuck is it then, sir? Exactly. What are ambulances for except to literally take you to the hospital and make sure that you're alive when you get there? I don't understand this whole idea that ambulances are not there to transport you to the hospital. That is their entire literal function. And this is not an uncommon take on what ambulances are for either. For some reason, people think that ambulances are like this luxury cruise item that you don't actually need to get to the hospital if you're having an emergency. People are just like, oh, just take a taxi or like call an Uber or just drive there yourself. It's like, what if I'm actually having an emergency and I have to take an ambulance? So this relates to another article that another friend of mine shared with me later on in the day. Apparently, there was a student who was having an anxiety attack to the point of having a mental breakdown over how expensive her tuition is. And it got so debilitating that she had to take an ambulance to the hospital. And after she got to the hospital, surprise, surprise, she got slapped with a bill of over $3,000. So I haven't read the actual article yet, and I'm going to do that right now. You can come along on this journey with me, and I guess we'll just see how this goes. Despite a lifelong struggle with panic attacks, Divya Singh made a brave move across the world last fall from her home in Mumbai, India. She enrolled at Hofstra University in Hempstead, New York. That's a lot of names being thrown out right now. To study physics and explore an interest in stand-up comedy in Manhattan. Oh, that's pretty cool. Arriving in the midst of the pandemic and isolated in her dorm room, Singh's anxiety ballooned when her family had trouble coming up with the money for a $16,000 tuition installment. And this is just an installment, mind you. I'm pretty sure this is not her entire tuition. Hofstra warned her she would have to vacate the dorm after the term ended if she was not paid up. At one point, she ran into obstacles transferring money onto the campus meal card. Already, this is so much. She was getting faced with eviction, and this article made it clear that this is after the pandemic started. So she's basically being told, hey, you're not allowed to live here if you don't pony up this $16,000. And then on top of that, she was running into obstacles transferring money onto her campus meal card. She was having trouble using the card that she specifically was given to eat. I'm a literally broke college student that didn't have money for food, she recalls. At that moment of panic, I didn't want to do anything or leave my bed. In late October, she called the campus counseling center hotline and met with a psychologist. All I wanted was someone to listen to me and validate the fact that I wasn't going crazy, Singh says. Instead, when she mentioned suicidal thoughts, the psychologist insisted on a psychiatric evaluation. Singh was taken by ambulance to Long Island Jewish Medical Center in New Hyde Park, New York, and kept for a week on a psychiatric ward at nearby Zucker Hillside Hospital. Both institutions are part of the Northwell Health System. So yeah, this basically details that she literally just wanted somebody to listen to her and to validate that what she was feeling was not completely irrational. That she was correct to feel some kind of fear about her future because of her financial issues. And instead, she got recommended to go to a hospital and was pretty much forced to go there. Even though the person doing this knew that she was struggling with finances, and the hospital would just become even more of a burden on her. Perfect. Love it. I love that. The experience, lots of alone time and a few therapy sessions, was of minimal benefit psychologically, Singh says. She emerged facing the same tuition debt as before, and then another bill came. Total bill, Northwell charged $50,282, which Singh's insurer, Aetna, reduced to $17,066. The plan required Singh to pay $3,413.20 of that. If she wasn't insured, that 1 week stay at a hospital would have cost her $50,000. A lot of people don't even make $50,000 in an entire year of working full time. What gives? Singh had purchased her Aetna insurance plan through Hofstra, paying $1,107 for the fall term. Aetna markets a plan specifically for students. Under its terms, students can be on the hook for up to $7,350 of the cost of medical care during a year, according to plan documents. Singh's Northwell bill of around $3,413 reflects the plan's requirement that she pay for 20% of the cost of her hospital stay. Although such co-insurance requirements are common in American health plans, they can be financially overwhelming for students with no income and families whose finances are already under the extreme stress of high tuition. Singh's Hofstra bill for the academic year, including room and board and ancillary fees, totaled $68,275. That's for an academic year. An academic year is 9 months. That's not even like an entire full calendar year. As a result, Singh found herself beset by a double whammy of bills from two of the costliest kinds of institutions in America, colleges and hospitals, both with prices that inexorably rise faster than inflation. For hospitals, there is supposed to be a relief valve. The Internal Revenue Service requires all nonprofit hospitals to have a financial assistance policy that lowers or eliminates bills for people without the financial resources to pay them. Such financial assistance, commonly known as charity care, is a condition for any hospital that wants to maintain its tax-exempt status. That status shields the facility from having to pay property taxes on its often expansive campus. Northwell's financial assistance policy limits the hospital from charging more than $150 for individuals who earn $12,888 a year or less. It offers discounts on a sliding scale for individuals earning up to $64,400 a year, although people with savings or other available assets above $10,000 might get less or not qualify. The IRS requires hospitals to widely publicize the availability of financial assistance, inform all patients about how they can obtain it, and include a conspicuous written notice on billing statements. While the bill Northwell Sensing includes a reference to financial difficulties and a phone number to call, it did not explicitly state that the hospital might reduce or waive the bill. Instead, the letter obliquely said, "We can assist you in making budget payment arrangements," a phrase that conjures installment payments rather than debt relief. So even though apparently it was pretty aware that Singh was not making enough money to be able to afford these payments, and she was probably making below that threshold that they previously mentioned of $12,880 a year or less, they didn't give her that discount. They said that they would assist her in making a budget, to pay back the bill, but they wouldn't actually relieve the debt of the bill at all. Resolution. In a written statement, Northwell said that although all eligible patients are offered generous financial payment options, it is not required that providers list the options on the bill. Really? Wait, what? How is that allowed? All eligible patients are offered generous financial payment options. It is not required that providers list the options on the bill. So technically, they have options available for you. But in the one place that would be, the most likely spot for people to actually look at to see the options available to them, which would be their bill, which has all the numbers and all the things that they're getting charged for, they're not required to put any relief options on there, so they just didn't do that. That's so slimy. I hate that. If a patient calls the number provided and expresses financial hardship, the patient is assisted with a financial need application. However, Northwell lamented, unfortunately, many patients do not call. Gee, I wonder fucking why. I wonder why they don't call the number that they probably don't know that they can call, especially if you don't list the options available to them. A KHN investigation in 2019 found that nationwide, 45% of nonprofit hospital organizations are routinely sending medical bills to patients whose incomes were low enough to qualify for charity care. Those bills, which totaled $2.7 billion, were most likely an undercount, since they included only the debt hospitals had given up trying to collect. Singh says the worker who took down her insurance information during her hospital stay never explained that Northwell might reduce her portion of the charge. So they just never told her. They just never told her that she was applicable for this. The student adds that she didn't realize that was a possibility from the language in the bill they sent. Again, because technically, they're not required to put that information on the bill. Northwell said in a statement that after KHN contacted it about Singh's case, Northwell dispatched a caseworker to contact her. Singh says the caseworker helped Singh enroll in Medicaid, the state federal health insurance program for low-income people. Foreign students are not generally eligible for Medicaid, but in New York they can get coverage for emergency situations or services. With the addition of Medicaid's coverage, Singh should end up paying nothing if the stay is retroactively approved, Northwell said. At the same time the caseworker was helping her, Singh received a final reminder letter from Northwell about her bill. That letter also mentioned Northwell's financial assistance, but only within the context of people who completely lack health insurance. Send payment or contact us within 21 days to avoid further collection activity. Sounds like some debt collectors out here. Like, we're going to start possessing your shit if you don't contact us. Despite stricter requirements from the Affordable Care Act and the IRS to make nonprofit hospitals proactively educate patients about the various forms of financial relief they offer, the onus still remains on patients, which is bullshit. If you have trouble paying a bill, call the hospital and ask for a copy of its financial assistance policy and the application to request your bill be discounted or excused. Be aware that hospitals generally require proof of your financial circumstances, such as pay stubs or unemployment checks. Even if you have health insurance that covers much of your medical bill, you may still be eligible to have your bill lowered or get on a government assistance program like Medicaid. You can also find documentation online. All nonprofit hospitals are required to post financial assistance policies on their websites. They must provide summaries written in plain English and versions translated into foreign languages spoken by significant portions of their community. Be aware that financial assistance is distinct from paying your full debt off in installments, which is what hospitals sometimes first propose. The criteria patients need to meet to get charity care and how generous a hospital is likely to be vary among institutions, but many give breaks to families with middle-class incomes. Northwell's policy, for instance, extends to families of 4 earning as much as $132,500 a year. Singh's family has paid off her fall tuition and half of her spring tuition so far. She still owes $16,565. Singh says the back and forth over her hospital bill continues to cause anxiety. The treatment I got in the hospital after I've gotten out, it hasn't helped, she said. I have nightmares about that place. The biggest benefit of her week there, she says, was bonding with the other patients because they were all so miserable with the way they were being treated. There is so much that we need to do about healthcare in general in our country, as well as education and the cost of tuition, and just the cost of pretty much fucking everything. And the fact that she went to a doctor about a mental health crisis, specifically concerning finances, and then the doctor literally sent her to a hospital that would make her specific crisis even worse. Just what the fuck? Why would you do that? She literally said that she was just looking for validation. She was looking for somebody to just listen to what she was going through and say, hey, what you're worrying about makes sense. And then maybe try to help her like figure out like ways to mitigate the cost or what she could do to help herself and things like that. But instead, they sent her to a psychiatric hospital like that she'd never asked to go for because she mentioned that she was having thoughts of suicide. And it's like she's having thoughts of suicide about her fucking finances. So why would you put her into more debt over that? Oh my goodness. I just don't get it. Tuition is too high. Healthcare costs too much. We live in this country where we constantly say that as long as you apply yourself and you follow your dreams and do this and that and the other thing, you will be successful and you will get all the money and then you will have a comfortable life. The process of getting that money is nearly impossible for 99.9% of us. Because if you don't already have money, especially if you're somebody like Singh who came from India and whose family was, from the sounds of it, not exactly super rich or anything, but was still willing to help her with her financial burdens, you're going to have some issues, especially if you suffer from anxiety. Like, our mental health is not taken seriously at all in America. We do not take mental health seriously enough. We are far from the happiest nation in the entire world. We're one of the most anxiety-riddled nations in the entire world, specifically because we do not focus enough on making it very clear and very like common knowledge how to cope with mental health problems. We have so many people that suffer from depression and from anxiety, and a lot of people have like suicidal ideation and suicidal thoughts. And when they ask for help about this, they're also like, when they go out to ask for help about this, they're also asked to put themselves in an even more difficult position because they have to spend money that they don't have, which is a big part of the reason why so many of us are so anxious and depressed all the time. Everything in this country revolves around money. Everything. And if you don't have money, it's so difficult to be happy. And it's so difficult to feel successful. And it's so difficult to feel like eventually everything is going to be okay. Point of all of this is, in Pokemon, every time you visit a Poke Center, these cute, adorable little creatures get fully healed at 0 cost. You pay nothing to heal your Pokemon after they get hurt. If Pokemon was made in America, they would probably charge you like $500 in-game dollars per Pokemon to heal them. We should probably focus more on making our healthcare system kind of like the Pokemon system, instead of continuing to make it more and more and more expensive while we, don't pay people more money to work. People deserve to live. People deserve to have life and to be healthy and to be happy, both mentally and physically. And that worth should not be tied up in what kind of job they have. That worth should not be tied up in how much money they make an hour. Human life is more valuable than $1. We need to start thinking about what our end game is. Because what we're doing right now is not sustainable. It hasn't been sustainable for a very long time, and it's only getting worse and worse and worse. We have a country of people who simultaneously say that education is important, but then also bash people who go to college or study something that is not a STEM job, because non-STEM jobs are not going to pay the bills. So what's it going to be? Are we going to have a society of people that can stay healthy, both physically and mentally, and be educated, and not have to worry about finances? Or are we just going to continue forever until we eventually die, or Jeff Bezos just gets all of our money, where money is like the only important thing that's just going to drive every single interaction that we have for our entire existence? Like, is that just going to be the way forever? Is that all that's going to matter for the rest of our lives and for the rest of this country's existence? It sure does feel that way. And it doesn't feel good. Anyway, that's kind of a down note to leave off on, but I hope that you're having a good day. And I hope that you continue to have a good day. I'm having fun stroking Pikachu's ear. It gives me a little bit of comfort. And I'll see you on the next one.